So my name is Vanessa Moreno. I'm a periodontist, and I have been a periodontist for 25 years. I have a periodontal practice that is going to be 16 years this year, and I have been extremely lucky that my team has been with me for the same amount of time. I truly love perio, and I was really excited and happy when you asked me to be interviewed, so I can share a little bit of what a periodontist does.
I'm so excited too. Thank you for doing this again. And so my next question is if you could describe the kind of services that you provide as a periodontist.
Sure. So a periodontist is a dentist that, who specializes in prevention, diagnosis, treatment of periodontal and peri-implant diseases, treatment of mucogingival problems like, gingival recession, inadequate amount of keratinized attached gingiva around teeth and also around implants, surgical placement of implants. And we also do extraction of teeth, ridge augmentation with soft tissue and hard tissue in preparation for dental implant placement. We do pre-prosthetic and aesthetic crown lengthening procedures. So pre-prosthetic would be when a patient has a tooth that has, caries that go below the gum line, and the dentist needs to have access to that. So by doing the crown lengthening surgery, we expose that area. Sometimes we have to remove only soft tissue. Sometimes we have to remove soft and hard tissue. And aesthetic crown lengthening is a procedure that we do when a patient has what we call gummy smile. So there is excessive display of gingival tissues. So we do recontouring of the gingival tissues, and also sometimes we need to do removal of bone if there is what we call altered passive eruption. So those are the other surgeries that we do. And we also do biopsies, which brings me to a point which I always like to emphasize how important it is to, for all of us, dental hygienists, dentists, and specialists, to do oral cancer screenings on our patients.
Definitely. Thank you so much for such a detailed answer and everything that you do as a periodontist.
Sure.
And then my next question is, what was the process like for you to become a periodontist?
So I'm originally from Brazil. So I went to dental school in Brazil. And right after that, my family, we moved to the United States. My father had a job position here. And so at that time, I was just fresh from dental school. So I started taking C courses, and we moved to Los Angeles. So I went to UCLA, and I was there at the perio department for about 2 years. And during that time, I did research in microbiology, research in bone and, dental implant interface. And also, I was lucky enough to be a part of publication of a chapter on the Carranza Clinical Periodontology book, which is widely used in periodontics. So after those 2 years, I then decided that I wanted to apply for, the perio program and, and pursue a career to become a periodontist. So I applied to a few schools, and during that time they had what is called matching program, which they would match, the candidates to the periodontal programs throughout the country. So I got accepted at University of Southern California. So we know there is a rivalry between USC and UCLA. So I'm able to, root for both teams, football teams. And that is a 3-year program. So while I was doing the program as well, my program was a combined program. So you would get the certificate in periodontics and also a master's in craniofacial biology. So I did both. And the master's program is a 2-year program, and then the certificate, the specialty is a 3-year program. But we do, combined.
Awesome. Thank you. It's definitely a lot to become a periodontist. And then I know you mentioned a little bit about what made you want to become a periodontist, but was there anything else specifically that inspired you to become a periodontist?
Well, to me, it's always, I always wanted to save teeth and also transform like an infected mouth into a healthy smile. So in dental school, during the rotations, I realized that I really enjoy, surgeries, but I didn't want to be or maxillofacial surgery. And they extract teeth all the time and they do, bigger surgeries. So that was not my thing. And then when I learned that perio, we also do surgeries, I was really excited. And, I was very lucky that I had an excellent female periodontist instructor in the clinic, and she was very inspiring. So, since, I was in dental school, I always, wanted to be, a periodontist.
Great, thank you. I'm glad you became a periodontist, and you're so great. I got to see a lot of your work while I did work with you.
Oh, fantastic. Thank you.
And then my last question for you is, actually second to last question. What do you like most about your job?
So to me, the most rewarding aspect is that to see that transformation of a diseased, inflamed, infected mouth into a healthy one. So it's rewarding, to know that by improving the patient's oral health, I'm also improving their overall health. Since we know that there's a connection between periodontal disease and systemic disease. To me, having like a healthy periodontium is the foundation of a healthy mouth, and a healthy mouth has this positive impact in the overall health of our patients. Another part that also is very rewarding to me is when we replace a tooth that either had a fracture, a tooth that, was hopeless we couldn't keep, but we replace that tooth with an implant, for instance, and then the patient receives the final crown, and they come back to see me, and it's really nice to, see their smiles after, the treatment. So.
For sure. And then that leads to my final question. How important is dental hygiene care in relation with periodontics?
So to me, it's extremely important. The success of periodontal treatment depends heavily on the maintenance care that the patients get every 3 months, seeing, the dental hygienist. And we know that there is no cure for periodontal disease. And after the patients go through the non-surgical or surgical treatment, in order to maintain the results that we achieve with the treatment and maintain that periodontal health, they need to keep up with those regular maintenances. So, and also the dental hygiene care, which also I'm including here, scaling with planing, which is like the non-surgical part of the treatment, is very important because after surgery, if they're not brushing, flossing, they're not going to do after surgery because there's going to be, the sites are healing, they have more sensitivity. So I think overall, I couldn't emphasize more the importance of dental hygienists in the treatment of, our patients. So they also, doing those recall appointments, they're going to be helping by removing the biofilm, removing the calculus, reviewing oral hygiene techniques, and also looking for, lesions. Again, the hygienists, they see the patients more often than they see than the doctors see. So I think that it's crucial that we have a very solid in any practice, whether it's a general dentist practice or a specialist practice, that the hygienists are really involved, and they're a very important part of our teamwork. And I always say that teamwork makes the dream work. So it is, the hygienist, the dentist, the specialist, always having, the patient in the center. So again, I can keep going on and on emphasizing how important I think the hygienists, are doing that in the care of our patients. So yes, I think it's extremely important.
Thank you so much. I definitely agree, and I just like hearing how collaborative you are with the hygienists and dentists that you work with.
Yes, I mean it's really nice. I love that interaction. And like I said, you as a hygienist, you see that you're gonna have that patient, the chair, with you. They build up a rapport with you. And I have patients that sometimes the hygienist they move from offices, and the patient will follow the hygienist. So it's because again, you're gonna be seeing that patient more often, and I think the patients really appreciate everything that the hygienists do, and again, plaque control, checking for increasing probing depth, right, and letting the dentist to know about it. Should we refer this patient out? What should we do? So I think it's again extremely important.
Definitely. Well, thank you so much. That's all my questions that I had for you.
Absolutely. My pleasure. Like I said, I was really excited when you text me, about this interview, and it's so nice to be able to share, what the periodontist, what we do, and I look forward to collaboration. And the more we spread the word out of knowledge is power. So the more we spread the word out of the things that we do, the better care we can provide to our patients.